There is a pill that 90 million Americans swallow every single day. It is the fourth most prescribed drug in the United States. Your mother takes it. Your father takes it. Your co-worker takes it. There is a very good chance you take it. It was created by Merck in a laboratory in 1978, approved in 1987, and it has not changed since. What has changed is what we now know about its side effects. Chronic cough that never goes away, dizziness, fatigue, kidney damage, dangerously high potassium levels, and in rare cases, a condition called angioedema, where your lips, tongue, and throat swell shut without warning. The FDA put a black box warning on it, their most serious classification, because it can injure and kill a developing fetus. 116 million American adults have high blood pressure. That is 47% of the adult population, nearly half the country. Doctors call hypertension the silent killer because it produces no symptoms while it damages your arteries, your heart, your kidneys, and your brain. It is the leading risk factor for stroke, the leading risk factor for heart failure, and contributes to more than 500,000 deaths in America every year. So when a doctor hands you this pill, you take it. You do not ask questions, you refill it every month for the rest of your life. But here is what your doctor did not tell you. In 2004, researchers in Mexico conducted a randomized controlled clinical trial comparing this exact class of drug against a tea made from a single flower. The tea matched the drug, not approximately, statistically. With 100% tolerability in both groups, the flower grows in gardens across the tropics, costs pennies per cup, and has been consumed safely at doses equivalent to 25 cups a day in West Africa, with 0 reported adverse effects. I'm going to tell you which flower, which trial, and exactly how much to drink. But first, you need to understand what is happening inside your body every time you swallow that pill, because the mechanism matters and is the reason this flower works. The pill is an ACE inhibitor. ACE stands for angiotensin-converting enzyme. Here is what it does. Your kidneys produce an enzyme called renin. Renin breaks down a protein in your blood called angiotensin 1 into angiotensin 2. Angiotensin 2 constricts your blood vessels and raises your blood pressure. The pill blocks the enzyme that converts angiotensin 1 into angiotensin 2. Without that conversion, your blood vessels stay relaxed and your pressure drops. That is the mechanism. One pathway, block one enzyme, lower the pressure. The most commonly prescribed version of this drug is called Lisinopril, brand named Prinivil and Zestril. Over 88 million prescriptions were written for it in a single year. The antihypertensive drug market is worth over $14.5 billion globally. The flower tea that matched it in a clinical trial works through the same mechanism. It inhibits angiotensin-converting enzyme, also known as ACE, but it also does something the pill does not. It acts as a natural diuretic. It helps your kidneys flush excess sodium in the urine, which reduces blood volume and lowers blood pressure through a second pathway. One flower, two mechanisms. The pill gives you one. The flower is Hibiscus, Hibiscus subdurifer, the deep red flower you have seen in tropical gardens and in the dried tea aisle of every health food shop in the country. In 2004, Herrera Arellano and colleagues published a randomized controlled trial of 75 patients with mild to moderate hypertension. One group received an infusion of 10 grams of dried hibiscus calyx daily before breakfast. The other group received captopril, a prescription ACE inhibitor, at 25 milligrams twice daily. After 4 weeks, hibiscus reduced systolic blood pressure from 139 to 123 millimeters of mercury. Diastolic blood pressure dropped from 90 to 79. At the end of the study, there were no significant differences between the two groups. The therapeutic effectiveness rates were 78.9% for hibiscus and 84.3% for captopril. This difference was not statistically significant. Tolerability was 100% for both groups. The hibiscus group also showed a natriuretic effect, meaning increased sodium excretion through urine, confirming the diuretic mechanism. A second study by the same group tested hibiscus, against lisinopril directly in 171 patients. Hibiscus was less effective than lisinopril for systolic pressure, but showed similar results for diastolic. Then in 2008, researchers at Tufts University conducted a randomised, double-blind, placebo-controlled trial on 65 pre-hypertensive and mildly hypertensive adults. 3 cups of hibiscus tea per day for 6 weeks lowered systolic blood pressure by 7.2 millimeters of mercury, compared to 1.3 in the placebo group. Among participants with higher baseline pressure, the reduction was nearly 14 millimeters of mercury. The lead researcher presented the results at the American Heart Association scientific sessions and noted that on a population level, even this modest reduction could significantly lower the incidence of stroke, coronary disease, and all-cause mortality. A 2022 systematic review and meta-analysis published in Nutrition Reviews compiled 17 randomized controlled trials and concluded that the effects of hibiscus on blood pressure were not discernible from those of commonly used pharmaceuticals in patients with stage 1 hypertension. The meta-analysis found that hibiscus reduced systolic pressure by 11.39%. Combined pharmaceuticals reduced it by 10.46%. The flower outperformed the drugs by nearly a full percentage point. In another trial, hibiscus showed superior blood pressure reduction compared to hydrochlorothiazide, one of the most commonly prescribed diuretics in the world. Researchers established that a 5 mm reduction in systolic blood pressure corresponds to a 9% decrease in mortality risk. 3 cups of tea per day in the Tufts trial achieved a 7 mm reduction. In participants with higher baseline pressure, it achieved 14 mm of mercury. Here is the honest caveat: hibiscus is not a replacement for all blood pressure medication in all patients. The evidence is strongest for stage 1 hypertension for mild to moderate cases. If you have severe hypertension, heart failure, or you are recovering from a heart attack. Lisinopril and other ACE inhibitors have decades of data showing they reduce mortality and prevent cardiac events. That data does not exist for hibiscus at the same scale. This is not a case of a plant being suppressed because it works. This is a case of a plant being ignored because nobody with a $14.5 billion revenue stream has any reason to fund the large-scale trials that would put a tea bag next to a pill bottle on a prescription pad. The trials that exist are small but legitimate, randomized, controlled, published in peer-reviewed journals, and every single one of them shows the same pattern. For mild to moderate hypertension, hibiscus tea produces blood pressure reductions comparable to first-line pharmaceuticals, with fewer side effects, at a fraction of the cost. The question is not whether it works. The question is why nobody is funding a trial large enough to change clinical guidelines. And if you are watching this and not subscribed, now is the time. Hit subscribe. We are pulling one of these out of the ground every week, and the deeper we go, the worse it looks for the people selling you pills. Here is what you can do tonight. Buy dried hibiscus. Flowers, sometimes labelled as hibiscus tea, flor de Jamaica, or roselle. You can find them in the tea aisle of any health food shop in Latin grocery stores or online for roughly $2 to $4 per bag. The clinical trial protocol used 10 grams of dried hibiscus steeped in 500 milliliters of water, consumed once daily before breakfast. The Tufts University study used 3 cups of brewed tea per day, each made by steeping 1.25 grams in 240 milliliters of boiled water for 6 minutes. The tea is a deep ruby red with a tart cranberry-like flavour. You can drink it hot or cold, you can add honey or a squeeze of lemon. It is one of the most widely consumed beverages in West Africa, the Caribbean and Central America. In Egypt, it has been used for centuries to treat cardiac conditions. In Mexico, agua de Jamaica is sold on every street corner. The total cost per cup is roughly 5 cents. If you drink 3 cups a day, your monthly cost is under $5. A 30-day supply of generic Lisinopril costs between $10 and $30 with insurance. Without insurance, it can be $40 to $60. The hibiscus costs less, grows in your garden if you live in a warm climate, and comes with the additional benefit of lowering LDL cholesterol, which the meta-analysis also confirmed. Do not stop taking prescribed blood pressure medication without consulting your doctor. If you're on a mild prescription and want to explore Hibiscus alongside it, bring the clinical trial data to your next appointment and have the conversation. Now picture this. It is 10 years from now. There is a jar of dried hibiscus flowers on your kitchen counter next to the kettle. Every morning you steep a cup of deep red tea while the news plays in the background. Your blood pressure has been in the normal range for years. The bottle of pills you used to refill every month expired in a drawer you never open. Your doctor was skeptical at first, but after 6 months of consistent readings, agreed to taper you off the prescription under supervision. You spend $5 a month on tea instead of $40 on pills. Your neighbour asks why you look calmer than you used to. You tell them about a flower that matched a prescription drug in a clinical trial of 75 patients. You tell them it works through the same mechanism as the pill and also has an effect the pill does not have. You tell them 47% of Americans have high blood pressure, and most of them have never heard of this tea. You tell them it has been consumed safely at 25 cups a day in West Africa for generations. You tell them a 2022 meta-analysis of 17 trials found it matched pharmaceuticals for stage 1 hypertension. Then you pour them a cup. It costs you 5 cents and it might be the most important thing you hand someone this year. And if you want to go deeper, head to our website where you can grab our free ebook on lost plant remedies, The System Forgot but the Science Never Did. Thanks for watching. Check out another video and make sure to hit subscribe.